Hi, my name is Kevin Matthews and I'm with Advanced Orthopedic Designs in San Antonio, Texas. And this video is for the board, the Georgia board. Jake had asked me if I might be able to come down and talk about some of my designs, and I said I'd be glad to. I've lectured in Texas, Oklahoma, and the annual meeting down in Mexico, just discussing some of the innovations and some of the modifications of designs that we've come up with and have been very successful in our practice. And if you're a member of another state organization and you would like me to come teach on this topic or any number of topics, I'd be glad to if my schedule allows. So what I'm going to lecture on, or in my favorite lecture, I've lectured on many topics, is AFOs, considerations in design and fabrication. And my most popular design and my favorite design that we've come up with, my nephew Chris and I, is what we call the Turbo AFO, or the Texas Turbo, which is a very rigid AFO that offers a wide open design like you would get with a lamination, but you can use polypropylene, and as you all know as orthotists, polypropylene is a lot easier to work with and a lot less hazardous to grind on and all that good stuff. So the Turbo AFO is what I use when I need triplanar control of the foot and the ankle complex, and I will expound on triplanar control and how this design is very effective at accomplishing that. Also, I'll go over padded foot plates and why we use them on all of our adult AFOs, and basically how to make them. They're really pretty simple to make. So basically I'm going to briefly go over different designs, and I'll expound on these designs in the lecture. The lecture will be anywhere from 2, 3, and 4 hours. Of course, the shorter the lecture, the less I'll be able to expound on the topics and less designs I'll be able to cover. So again, this is the Texas Turbo AFO, rigid floor reaction for triplanar control when you have significant issues around the foot and the ankle. Another design that I'm going to talk about is an unweighting orthoses, the wraparound AFO, which is to unweight the foot and ankle complex. Very thin plastic, flexible, but once it's on, it's very strong. And I'm going to discuss how we cut, separate the cast, and then put it back together to unweight the foot. In this design, I've been able to accomplish 100% unweighting of the foot-ankle complex. And I'll go over diagnoses and when that would want to be used. Another design we've come up with here recently, again, this is Texas and it's hot, is just a simple, typical solid ankle design with a wide open posterior section to be a little bit cooler, but again with the reinforcing strut to make it strong. So this is one that we've actually just made recently as a sample, and I haven't used it on a patient yet, but I'm sure it'll work fine. Another thing I'd like to discuss is this design of neuropathic walkers and how we make these. We pride ourselves on keeping them low profile while the sole looks thick and all of this stuff. It's really only about 1 inch, so we only have to put a slight lift in the contralateral shoe to balance. But what I'd like to go over is the benefits to making these with a removable insert, and it fits in there very well, so it's not real easy to take out. And this one has been cut in half just to show the materials that we use. And here we've basically we have the injectable silicone that we've put inside the forefoot to unweight the forefoot. But I'll go over fabrication of the removable insert and how we do that, and how we're able to keep the design relatively low profile but have a very, very good design. Also, I'll go over the PTB, which basically we do the same as our wraparound AFO by cutting and separating it. The wraparound AFO is for temporary condition, lasts about 6 months before it starts to crack. This is something that would be definitive, and this will unweight anywhere from 30 to 80% of the weight through the foot and the ankle complex, just depending on the shape of the leg and how aggressive we get and actually what we can actually get away with. I'll also go over the use of prosthetic socks, 3 and 5 ply socks, to manage fluctuations in size during the day, and also over time makes these, you know, very durable designs, and having the socks allow for changes without having to remake the orthoses. Another design that's worked well for us is for idiopathic toe walking. Rather than go with a full-blown hinged AFO with a plantar flexion stop, kids that can heel walk but are just idiopathic toe walkers, they have good range of motion. We've been very successful with just putting a little extension bumper on an SMO to block plantar flexion. The child can still plantar flex, but this little pad and piece of plastic digs in the back of their calf. Not very comfortable, breaks kids of toe walking, and we typically wear one pair 6 months and the child is cured, and no bracing is no longer indicated. This has been very successful in our practice also. I'll also go over an SMO with a long lateral trim, vertical heel for low-tone kids, similar to the Sure Step. I've been using this design for years, and it works well. I also use Sure Step, but I'll go over the triplanar characteristics of this design and why it should be part of your practice and a design that you offer low-tone kids. Also, I may go over the custom molded leather ankle gauntlet. We make ours seamless on the inside, and we've got some really helpful tips on stretching the leather and how you can make this a lot easier to fabricate by utilizing tools you already have in your lab, meaning vacuum. Another design that I would like to show you is for inner boots. We have had outstanding success with microcell puff as a inner boot and in other areas, but it is durable, it is flexible, it is easily modified. You can grind or relief, you can add padding. It has been very well received in my practice. I think it's better than even the inner boots made with silicone, because it's very, very lightweight. It's more breathable, flexible, and remarkably durable. I've never had one of these wear out or deform to the point that it had to be replaced before the entire AFO needed to be replaced. Another design that I'd like to go over briefly is the single upright AFO for your posterior tibialis tendon dysfunctions or similar. Medial arch collapse, grade 3. You're not going to put them in plastic because they're not flexible. They have plantar flexion contracture. The heels is slid off into valgus. One thing that we do is incorporate a custom foot orthotic covered by Medicare in the shoe, and we attach the medial T-strap directly to the foot orthotic to get more aggressive control and support of the foot-ankle complex. So we have more designs and more things that we do that I will go over, little tips and techniques that will help you in your practice, make things easier, make things nicer. I'll go over some of our techniques in modification and materials that we use depending on the individual situation. So again, this class will be anywhere from 2 to 4 hours, whatever you'd like. And feel free to call if you have any questions, 210-657-8100. And again, if you're with another state organization, if time permits, I would be happy to come out and lecture at your meeting. Thanks for your time. Have a great day.